must constantly look at things in a different way.
The Healthcare Education Transformation Podcast was created by two physical therapists out of the desire to learn more about the different educational roles in physical therapy and healthcare, and how healthcare education works by talking with educational leaders and people with different perspectives within physical therapy and across interdisciplinary lines on how education can be improved to disrupt the status quo of healthcare education. This is our journey, and thanks for listening. Are you a third-year physical therapy student that excels on tests when you have study guides, checklists, and deadlines? With all of the information available about how to prepare for the NPTE, it's easy to get disorganized and not feel prepared going into the big day. NPTE Prep Success is an online course that provides PT students easy-to-use study guides and step-by-step guidance through the NPTE preparation. To learn more, visit kylericeprep.com. Thank you again all for your continued support, and now for the show. Hello, everybody, and welcome to another episode of the HET Podcast. I am your host, Brandon Powen, and today I have the esteemed pleasure to welcome a very special guest on who actually is from an area not too far of where I grew up in Illinois, which is actually quite a small world, and we were kind of talking in the pre-show about that. But nonetheless, if you were on social media or kind of following the PT world online, I have no doubt you have heard of this person before, as I am thrilled to welcome Dr. Vince Gutierrez onto the show today. Now, to give you a little background on who Vince is, he is currently a PT at Primary Care Physicians of Joliet. He previously worked as a physical therapist in the emergency department at Palos Community Hospital. He is a blogger with movementthinker.org, clinical faculty at Governor State University, a contributor to the DPT Mentors Facebook group, and he was named as one of OpDoc Media's top 40 influencers of 2017. So Vince, thanks so much, man, for all you do, because I know with all the things you're doing between clinic, education, and community service, I'm sure life's keeping you pretty busy on top of personal stuff. So thank you so much for all that you do, man, and thanks for coming on.
Man, I'm extremely grateful that you asked. Thank you.
No, we're honored to have you because, Vince, I want to kind of start off because I get that some people may not know, your origin story and seeing how you've gotten to where you are, because really, I think it's a truly remarkable story, and I think it's incredible what you've done for the good of your community, patients, clinicians, and our profession. So would you mind kind of sharing your story about kind of how you became a PT to kind of where you are now?
I think it all has to start off with just gratitude. So you'll see how this theme plays forward in my life and in my career. So I grew up in the youngest of seven, and I'm the only one to have graduated high school. So obviously the only one to go on to college. My brother died of a drug overdose in 2008. I've had family in and out of prison. And I always say this when I go out and give lectures in the community. I'm not supposed to be where I'm at, but I got lucky. I'm blessed. Some good things fell my way. I got into some trouble as a kid. And, thankfully my dad, who is my Superman, he kind of set me straight. And I can honestly say that for 30 years, I've never made a decision that I felt would let my dad or my family down. And that's really where it all started. So in college, I was studying to be a teacher, and I was in an upper level biology class, which also housed some PT students that were in the class that were studying their pathoanatomy and pathophys. And there was a PT professor in there who taught the course for the day. He's asking questions, and I'm raising my hand. That's just me. I'm go, 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 go. And at the end of the day, he comes down and he said, look, I talked to your advisor. You have a 3.89 GPA. You'd fit in perfectly in this profession. If you're interested, we would love to have you. So my story's a little bit different because I actually got recruited to become a PT. This wasn't even on my radar initially. I was studying to be a biology teacher. And when I was out in the field for teaching, I had a negative experience. One of the things that kind of sets me forward in life is if I'm not proud of what I'm doing, or if I'm not enjoying it, I'm not happy, I walk away. I leave it and never look back. So I had a really negative experience, political stuff in the education system, and it wasn't what I signed up for. So I called up the school and I said, hey, what do I have to do to get in? And I went through, did my volunteer hours, got everything I needed to get done, got accepted to Governor State University, graduated with a master's in 2007. One of the things that set me on my route, anybody who knows me from social media knows that I am a big McKenzie advocate. I love MDT. It was my base. It's how I started. But how it started was with me calling BS. Again, I grew up in the hood, and sometimes you can't take the hood out of a kid. So I went up to the instructor, the clinical faculty at the time, and I said, look, man, I call BS. You came here with no research, no evidence, just your own experience. He said to me, if you don't believe what's going on, come to a clinical with me. We all know the lottery system. You go where you get your pick. And again, I'm blessed. I'm lucky. I'm grateful. I got picked number 1, second round. So I knew where I was going. I was going to disprove the McKenzie method. And when I was there for the first week, it was like a cult. Looking from the outside in, that's what it looks like. Everybody's doing press-ups. And I had worked in a clinic for 3 months at the time as a tech, and I realized that back pain could go on for a long period of time. It doesn't always get better. Week 2 in his clinic, almost everybody was better, pain-free, and I had absolutely no clue what I saw. So I asked him, hey, how can I learn this? Buy the books, go to the study group. I am grateful. I am blessed. My first 3 years, I was in a study group with Annie O'Connor and Melissa Kolsky, authors of A World of Hurt. Tom Lotus, a chiropractic physician over at Midwest Orthopedics at Rush. David Pleva, an instructor for the McKenzie method. Jane Borshammer, an instructor. Ella. I mean, I was around the who's who of this method, and man, I learned a ton. My first time at the meeting, Tom Lotus, there was a patient who had knee pain at 30 degrees of knee flexion on the treadmill. And he's like, what do you think it is, kid? I said, come on. You know what that is? That's IT band cross friction syndrome. And he looked at me and said, all right, don't open your mouth again and just watch. They did a bunch of side glides with the patient, and the patient was pain-free. I had absolutely no clue what I'd seen. And I spent, years of my life studying. And because of the time that they spent with me to teach me the stuff that I didn't know, I spend my time now on my off time, really, 3 kids and a wife. I spend my off time doing the most that I can to teach the profession as we move forward. So that's my story in a nutshell.
Well, I love it. And Vince, I kind of want to dive into that because you kind of bringing up teaching there, of course, knowing that you've been doing a lot of teaching in the past, kind of with more along with ethics, including doing some work at the IPTA meetings for CEUs and even from universities. How did you go about specifically teaching ethics at these places? And what did you find that worked and even what didn't work?
That's a good question. So what I saw in the profession, the stories that I heard, it's just sad because people are getting burnt out due to productivity issues, and there's major ethical conflicts going on in the clinic. People feel stuck. So I decided to create a course on ethics and burnout. I gave the course at an IPTA meeting, and everybody loved it. Clinicians absolutely loved it. There was stuff they didn't hear before. There's a good, if you Google Medicare Unmasked and Wall Street Journal, you can find out how many or what physical therapists are getting reimbursed per year that they're treating patients with Medicare. You can reverse engineer math to see how many patients they're actually treating if you understand the average reimbursement per session, and see that sometimes that's just not possible. So I was bringing in real cases of therapists that, there were settlements issued and millions of dollars that they were fined in the settlement, and relators, people who told on these clinics how much they were getting paid, millions of dollars. This information needs to get out there because nobody's teaching it. And so I taught this course a few times as a CEU, as an IPTA course. I taught it at some universities. And then, like I said before, if I'm not having fun, if it stops becoming fun, I walk away. This course is now just on a thumb drive collecting dust. I taught it at a university, and after the course was over, one of the professors came up to me and said, that information is great, but we can't invite you back again. I was just at a loss for words. I'm like, what do you mean? She said, there are so many students right now that are questioning the clinicals that we're sending them out on and whether or not it's ethical. And they're talking about becoming relators. And we can't have that. Again, I taught in high school, and the reason why I got out was because of politics. This one experience is enough for me to walk away. I don't charge for a lot of the stuff that I do, and I didn't charge for this. And the second that it stops becoming fun and people don't want to hear the information, I walk away and go spend my time elsewhere. I got 3 kids and a wife. I've got better things to do with my life other than, teaching people that don't want to hear. So yeah, the course is not collecting dust on a thumb drive.
Yeah. And I mean, that certainly makes sense given your story. And I'm just kind of curious, and I just want to hypothesize a rationale potentially. to why they said no. Apart from that, I wonder if part of it was because they didn't want to burn clinical sites and then have to be screwed for their students.
It's funny because this is a question that, I got to see your questions a little bit beforehand. And so this jumps right to what do I think needs to be done in education. And it's the system is broken. So we are sending students out to clinicals where they're seeing unethical behavior, illegal behavior, and it's not talked about enough. Because it's not talked about, that seems to be the norm. And if that's the norm, when they graduate and come out, they become part of the norm. And the only way that we can change things is if the school stops sending them out to that clinical, but the schools can't afford to stop sending them out to that clinical because we have so many schools and not enough clinical sites. And until that change happens, nothing's going to change in terms of clinicals. I think clinicals are where we have the biggest opportunity to really teach the student what it's like in the real world. But unfortunately, what we're teaching, the real world we're in, it's not good.
I want to kind of take a different direction here because going through the ethics here a little bit, I'm just kind of curious because, in terms of from your journey, what have been the most challenging and biggest ethical dilemmas that you've personally faced over your career? Like, apart from what you've heard from others, like, what have you experienced?
Gosh, again, everything for me has to pass the dad test. My dad is a Vietnam vet, 101st Airborne. He was a medic. My mom walked away from my life when I was 5. He raised me and he did the best he could. And he lived his life with honor as good as he could. And to me, I need to try to live up to fill his shoes. And if I'm doing something that's unethical or illegal, then I wouldn't feel proud to tell my dad what I'm doing. So again, I'm going to tell people, don't do what I do because what I do isn't necessarily the most professional thing. I worked at a job that unethical things were happening. My first job, right, was great. I was treating back pain, almost exclusively back pain. And as a new grad, it was taking me 14 visits to see a patient, classify a patient, improve the patient, and discharge the patient. After 3 years, that came down to 6.2 visits. They were tracking it. I wasn't. And so obviously that's great clinically, but not necessarily best for the business. So I was at another clinic where I was practicing the same way. The owner of the clinic pulled me aside and said, we can't do that. You have to keep these patients coming because we got to keep our doors open. You can't just discharge patients. You have to find something to work on. And he said, I hope you understand. So I understand you got to keep your doors open. I get it. 2 weeks later, I never changed what I was doing because, again, dad test. And he pulled me aside again and said, I thought that we had an understanding. I said, we do. I quit. And I walked out at lunch. I hear it frequently that PTs feel stuck in situations. They're burnt out. It's a decision to make. It's a choice. It's a hard choice. But I really think that until we understand what your own personal principles are, you're never going to make that decision, because you're so worried about feeding your family. Again, 3 kids and a wife, you're worried about feeding your family that you're afraid to make the right decision. And personally, unemployment in our profession is like, 1%? I know I'm going to find a job. It may not be my personal ideal job, but I know that wasn't my ideal job and I needed to get away from it. Otherwise, I was going to hate myself and I couldn't do that. So that is a major ethical dilemma that everybody's facing on a daily basis because that clinic was more the norm than the outlier, but people aren't making the decision. So that's my ethical dilemma.
Interesting. And I just, now that you kind of mentioned that story, a thought that just kind of comes to my head. But, I just wonder, like, if you discharge those people early and you got more people in, a val code's going to get you a lot more. And
people don't look at it that way.
Yeah. Am I crazy?
It's sad.
Like,
no, you're right. And it's funny because when I took the MBT courses, Scott Herbawi, who's one of the instructors, he brings that up as a point, but you have to have the marketing machine in play so that way patients know that they can come to you and that you are a leader in that type of issue, whether it's back pain, neck pain, so that way you can do that. Otherwise, you rest on your laurels and you keep a patient for a year or 3 years from some of the stories that I've heard. You keep a patient coming for 3 years because it's guaranteed money.
Yeah. No, I mean, it makes sense. Vince, I know you had mentioned, of course, your thoughts on, education, but apart from not necessarily even just the ethics, like apart from that, with all that you've done from teaching and kind of from all the various roles and positions, how has your view of DPT education changed from everything you've done?
I got a DPT because why not? Okay, so I graduated in 2007 with a master's. I completed my Mackenzie credentialing in 2010, and I was just looking for something to do. So I went back to get a doctorate degree, the transitional doctorate. And PT school for me was never hard. The transitional for me was not hard. It was just time. And what I think how I think school is failing students, and it's in what's the textbook? It's called I can picture it right now in my head, the Handbook for Teaching Physical Therapists. In the forward, I totally forgot this question. I didn't prep this at all. But in the forward, there's a section in there, it's like 2 sentences long, that our job is not to teach the students, but our job is to teach the students how to think about what they're thinking about. And I really think that critical reasoning is what's failing right now in education, because students are being spoon-fed information, and all they have to do is regurgitate that information. Again, for me, I am almost purely auditory, but I have a memory that a lot of my colleagues would love to have, because I remember everything. And so PT school, I showed up with a magazine, and I'm looking at the pictures in the magazine while I'm taking in the lectures, because I can regurgitate the lectures back, and that's all that was really needed. And it's unfortunate because there was only one class in my master's program that I can actually say that was hard. And man, I am so grateful for Dr. Jennifer Ryan, because she really forced us to think. She didn't feed us any information. She made us go out and find the information and create the patient and figure out what are going to be the causes and effects of doing different modalities with that patient, such as exercise, heat, anything that you could provide to the patient. What is going to be the side effect from that modality that you do? And that really forced critical thinking. That was the most fun that I had, even though it was the hardest class. It was the only class that I really had to study for in that program. And it was the best class ever. So I'm extremely grateful for Jennifer Ryan for how hard she pushed us. And what I see today is that critical thinking isn't necessarily taught. They go off PowerPoint slides. I think I've taken about 60 students in my career so far. And what's disheartening to me is I had a student come in, and we were chatting, and I said, well, look, can you go into your Goodman book? Can you go into your orthopedic book? And just bring the book in tomorrow, so we can start covering some of this stuff, because I know the information's in there because I've read it. And the student said, sorry, but we weren't required to get any books. I was like, are you serious? This is not a failure of the student at that point. This is a failure of the university. And trust me, I brought it up to the university, and I had the discussion with their clinical coordinator. I wanted to have a discussion face to face with that person, because I was disappointed that these students were being fed PowerPoint presentations instead of actually going out and reading the textbooks to get the information that everything was based off. Yeah, I was frustrated, and I think that's part of what's lacking, is that the DPT program may not be hard enough. This is a great honor to be called doctor. You've reached the pinnacle of your clinical education. We really should have to earn it. So yeah, that's part. And I'm an N of one. This is only one opinion, but that's my opinion.
Yeah, and Vince, I want to dive into that, because that you mentioning kind of your experience with Dr. Ryan. Apart from what you had mentioned, because I recognize that some faculty are likely listening to this, would you mind sharing some kind of more specific examples of kind of how she would challenge that, just to kind of get a real world understanding of those methods?
Awesome. So again, Dr. Jennifer Ryan, if you are listening to this, I am eternally grateful for how hard you pushed us. I had the opportunity to run into Dr. Ryan again at Palos Community Hospital. She came in to teach. And there was one thing that she offered us. I don't even know if she's still teaching or what she's doing, but there was one thing that she offered us as students, and that was something called the Matrix. And it was, I could still picture this Excel program. And you were given a case, and then you had heart rate, your blood pressure. You had all the different systems down the line. And your next line was like your modality, exercise. What would happen if you exercised a normal patient? What would happen if you exercised a patient on a beta blocker? And how does that affect everything down the line? And so she didn't feed us any information. And she didn't even care if we were right or wrong. She only cared if we could have an intellectual discussion and cite our sources. She really forced us to go into the research, into the textbooks, and get the information so that way we could come out with knowledge instead of a PowerPoint presentation and it was just shoved into us. It was, man, I want to say, when I say her class was the only class I studied for, legit, it was 10 to 15 hours a week for that one class. I didn't put that time into any other class in PT school. That was a rough class, and I'm eternally grateful because she taught us how to work hard. And not everybody in our class made it through that class. And that's how I believe it should be in an doctorate program.
Yeah, and Vince, apart from obviously, of course, time, why do you think that some of those methods aren't being kind of utilized more commonly?
There's too much to teach. You have to make sure that, when people are choosing schools, they're looking at schools based off of, 1 year pass rate, 3 year pass rates. You got to make sure that you're teaching to the boards and not necessarily teaching to the clinics, because I see it now. I get a lot of college students that are coming through me to get their letter of recommendation. And so they're doing a lot of hours with me. And that's what they're talking about. They're talking about the cost. They're talking about what's the 3 year pass rate? What's the GPA that's needed to get in? And so I honestly think that it's getting lost in the shuffle, the whole critical thinking portion, because the requirements that they have to get out into these students is it's pretty demanding. But then after listening to the APTA president's lecture during, I don't know if it was during next or if it came out beforehand, when I hear that some schools are inflating the credits by up to 20% over what CAPTA requires, that's kind of disheartening for me. Why are we forcing students to go through more school than they need to go through when we're not, in my opinion, we're not teaching the critical thinking aspects that's required for the actual profession instead of just, force feeding them information. Yeah. Again, N of one.
Well, and there is, and we know for a fact that there is certainly a requirement to do well on those licensure exams. That can't be denied.
Of course. Don't practice, don't get paid.
For sure. Well, and Vince, kind of just diving a little bit more into kind of your clinical career now. We'll come back more to the education in a little bit, but with your career and all that you've gone through, I just love to kind of pick your brain on what have been the biggest mistakes you've made and learned from in your career when it comes to patient care.
Oh gosh, when I was young, first 2 to 3 years in, I was cocky. I was egotistical. I fixed people. I failed people. I. And that was the biggest mistake that I made, was it was all about me and not about the patient. It was my success and it was my failure. It was never us. It was never ours. It was never yours. And that's part of what, like 12 years later, it's like gratitude. Tom Lotus, Daniel Connor, Melissa Kolsky, Jane Borshammer, I'm eternally grateful. When I was 3 years in, they allowed me to start taking the lead on some of the cases. At our study group, we held a study group once a month, and we treated real people, real patients that other clinicians were having trouble with. And 3 years in, they let me start taking the lead. And at the time, I thought I earned it. I deserved it. I belong here. And 12 years later, I realized, man, they bestowed this upon me. They honored me with this. They allowed this to happen because they didn't need me to do that. They could have done this on their own, but they helped to build a clinician from a newbie who knew nothing to somebody who can actually lead people. And I'm, again, eternally grateful for that. But it took me 8, 9, 10 years. I burned a lot of bridges. I rubbed a lot of people the wrong way my first few years in, and anybody at Payless Community Hospital will tell you that, because they had to put up with the tornado that I was coming in there. But learning how to work on a team with people that I respected, man, it was great. It was, an MVT therapist standing next to a manual therapist, having conversations, and neither one of us saying you're wrong. It was more about, what can I learn from you after ARC this? We learned a ton from each other. What can I learn from you? What can you learn from me? How can we bring this together to give a better patient experience, to help that patient as much as we can? And that's where I think I grew the most, is it stopped being about me. It started being about the team, and it started being about the patient. And I don't know if you can teach that in school. It's hard.
Yeah. Vince, I know apart from all the teaching, you've been being a boss pretty much with getting involved in the community. I mean, especially, I mean, I don't know Joliet that well. I mean, I've been there a few times. I've driven through a little bit. I've been there for a couple of years off and on. But I don't know that area near as well as you do. But that definitely, to me, looks like a rough area. And I would love to know kind of how you've gotten involved to the level you are with your community and how you've really effectively been able to really hit solid community service, showing the value of PT, since the beginning of this to kind of show people how can this be done, especially in a town, correct me if I'm wrong, that's kind of rough like Joliet.
So there are parts of any city that's rough, right? And I grew up in a rough neighborhood. In fourth grade, one of my classmates was shot in the head. Drive-by shooting. My house was shot 8 times. My house doesn't even exist anymore because it was burned down by gangbangers. I don't have the luxury of going back to reminisce about where I grew up, because when I went back to reminisce about where I grew up, it's an empty lot. Nobody's ever built there again. It was rough growing up. I firmly believe in education. So, just today, coming home, I dropped off 100 book bags for District 86 kids, to try to give them a little bit of help, because it's a poor area. I grew up, I don't know if you guys understand the term government cheese, but I grew up standing in a line getting government cheese because our area was one of the poorer areas in the city and the state. The parts of that city, they're still living under the poverty line. And it's a big part of the city. There's a whole area that's just, it's called, Tent City. It's a homeless area out in the woods. It's rough growing up there. It is. It's still rough today. There are multiple murders just in the past month. Not to try to shine a negative light on the city, but it's reality. It's rough. And if we're not giving back, how do we expect the next generation to grow and to improve their lives? When, I said my mom walked out of my life when I was about 5 years old. I don't have many memories, and I definitely don't have any memories after the age of 13. And so it was rough. Latchkey kid, my sister dropped out of high school to take care of me when I came home from school. That's happening nonstop over there in those neighborhoods. We need somebody to step up and step out and actually, give back. And so once I established myself in my profession and I felt confident that I can go back to give back, that's what I did. And if we're in this profession, we all have an obligation to the profession. We have an obligation to try to give back to the profession that is feeding us. And so the first year I was there, I got in front of 1,000 people, local meetings, Chamber of Commerce, community meetings, church meetings, 1,000 people in the audience over the course of the year, not to mention the over 200,000 people that I reached on Facebook for those communities. But it takes an ask. The worst thing that can happen is they could say no. So in order to understand this, you have to understand tactics, right? And don't use tactics, because tactics can be a dirty word, but it all depends on intent. I was having this conversation with, I don't like to name drop, but I'm going to here, Dr. Richard Severin, when we were at, I don't know, a spring assembly, something, right? Some meeting. And there's a difference between marketing and educating, and it's all based off of intent. If my intent is to bucket somebody or put somebody in a funnel so that way I can get them to come into a clinic, well, then that, to me, that's a sales tactic. But if my intent is to go out there and educate people about what we do as a profession, what are the good things that you're going to see in physical therapy? What are the things that if you should walk away? I don't think that's never me selling me. That's me looking at the profession objectively and getting out there and trying to educate people. We have an obligation to give back. And every time that I go to a meeting, whether I speak or don't speak, I donate to whatever it is, wherever I'm at. And they sometimes allow me to speak and just, talk to 30 or 40 people. Sometimes they don't. That's the risk that we take. The worst thing that can happen is they say no. Okay. So now regarding tactics, everybody in our profession needs to go listen to Gary Vaynerchuk. There are a lot of people in our profession that are selling within the profession using the same tactics that he gives away for free. And if you can just master some of these strategies, you can become a celebrity in your neighborhood, such as creating a Facebook page that's about the neighborhood and not about you. such as creating a Facebook page that spends all of your time educating about the profession, but never trying to sell yourself. You become a local celebrity, not based off of what you do, but how you help the community. When I would do interviews at one of the local universities for people going into the profession, the number one reason why people wanted to get into the profession is because they want to help people. Accountants help people. Financial analysts help people. Paper boys help people. We all have the ability to help people, but why are you choosing this profession to help people? And I believe that I can help people become more health literate. I believe that I can help people solve their own problems in healthcare. And that's why I want to get in front of as many people as possible. And these are just some of the strategies that you can use. You have to get out there and listen to Gary Vaynerchuk, read his 4 or 5 books, I think now. Understand brand building. That's what I would say has helped me the most with getting out into my community.
Yeah, I echo those comments, Vince. And Gary V is certainly a very instrumental and inspirational figure. And if you all haven't really heard of him, I have a few links down in the show notes. Please check him out. He's awesome. He's got a lot of good nuggets on not just what Vince had said, but a lot of other things too that's really valuable. And Vince, I'm curious, based on what you've been able to do, what have been some of the highlights of things you've been able to positively influence in your community to this point?
Oh, gosh. Hey, goosebumps. I start talking about the stuff that I get to do out in the community. Last year during the mission, so there's a place in Joliet called Morningstar Mission, and they cater to homeless people. At the time as I was building up my brand in the city, I stood out on the corner for probably 10 hours that day, just collecting money for Morningstar Mission. And what was awesome was how many people would drive by. I can remember Councilman Terry Morris. There were 4 council people that drove through my intersection that day. The mayor of Joliet drove through my intersection that day. And when they put their money into the tin cup, what they said was, "Thanks for what you do, Doc." And I think that's really telling, because we, in our profession, we still have a brand problem where some students or some people are afraid to call themselves doctor of physical therapy. But when you get out there, the public will accept it. I think we're too busy worrying about the infighting within our own profession to get out there and call ourselves doctor. But that's one of the better things that I got to do, is just get out there and give back. Last year, I gave over 100 book bags at this back to school event hosted by one of the councilwomen, Betty Gavin. And these are kids that, again, where I grew up, you weren't expected to graduate high school. It was a 50-50 shot. Again, I'm one of 7 to make it through. So I got to go back and give back. I get to go to these meetings and educate the public. We brought so Joliet, Will County area is one of the hotbeds in the country for opioid overdoses. And through the connections that I made with Will County, I was able to bring the county's educator on opioid deaths and specialists to an IPTA meeting, so that way we can be educated as a profession as to what's actually happening out there in the real world, not just within our little bubble of a profession. Yeah, those are some of the things that just, man, it warms my heart to be able to go out there, and whether you make $20,000 a year or $200,000 a year, just to, shake hands, share a meal, and let's have a conversation. I had this conversation with, again, Rich. We had a long conversation that night talking about PT Day of Service. And to me, it's awesome that we're doing it, but it's sad that we only want to do it one day. He's listening to what I'm saying. And again, a lot of the people in the area that I serve, they're living below the average annual income. Some of them are living below the poverty line. And this is the most they're going to get, is when I get out there and educate them. It's the most that some of these people ever get. They don't trust some of their healthcare professionals. And so we get out there to educate as best as we can. It doesn't have to be one day a year. We can do this every week. My wife allows me to do it 3 days a month. And so, I'm again, 3 kids and a wife. My wife is my saving grace, because she pulls me back into reality every once in a while, because sometimes I go overboard and I want to help everybody. So, my wife is allowing me to go out into the community now at least 3 days a month to help out as many people as I can.
Well, I love it, Vince. And, it was really interesting when you and I actually had met in person back at Ben Cormack's class at Entropy Physio last year. And through off and on discussions, we were kind of talking about, APTA and about the role and kind of how things were with that. And, I thought your answer really encompassed a solid integration of different points that, various people have claimed. I'd love for you to kind of share, what are your overall thoughts on the APTA?
I don't remember exactly what we talked about, but I'll give it a go. So what I think we really have to remember is that the APTA is made up of a bunch of ones, right? An N of one. I am the APTA. You are the APTA. We are all of us that are members, we are the APTA. And when we have a complaint, we have to figure out what we could do to push the profession forward. We can't depend on our national organization to fix a local problem. We have to fix the local problem. We can't depend on the national organization, which represents a bunch of sections of our own profession, to fix the outpatient orthopedic referral process. We can't depend on that. We can't depend on them to create commercials that we can create. And I think part of the problem is that we take for granted that just because this is a national organization that they must have unlimited funds. But unfortunately, we only, I don't know, last check, but it was like between 30 and 40% representation. How can we expect them to do anything when they don't even speak for a majority of our profession? A majority of our profession is not members of our national organization. So our national organization is going to be limited in what it can do. I hear the arguments from the other side. There's no value in the membership. I counter that with saying, Illinois now has direct access. Texas now has direct access. Nobody ever thought that these two states would ever get direct access, but we have it now. The Medicare cap is gone. There's no cap. You just have to, justify in your documentation. There are a lot of good things that are coming out of the APTA, but everybody highlights the negative things. They don't see personal value because they don't understand the benefits. They don't see that you can go online and order some things from certain websites and get 20 to 50% off of stuff. I don't use those benefits. I'm a member out of obligation because they are my voice. It's the only voice I have in Springfield. It's the only voice I have in DC. And I think that we need to do a better job of supporting our voice. Otherwise, our voice will never be heard.
No, I agree. And I completely agree with that point of view, Vince. And, I'm curious because I know you've been involved in a few meetings and of course been involved with, APTA on certain levels as well. So do you feel also that, I know some people, as they've gotten involved kind of in APTA, they have also kind of run into some frustrations and some limitations with that. What are your thoughts on that?
Look, I'll be the first one to say it, right? So you've heard me say multiple times, when I stop having fun, I walk away. I am the chair at this point in time, and I say that for a purpose. I am the chair at this point in time for the IMAP program, which is a mentorship program for the Illinois Physical Therapy Association. I go, right? I am intense in what I do. I see something and I want to tackle it and I just want to go after it. And I want to grow this program so that every student in the state sees the value in their IPTA membership and joins in order to get membership. I want the PTs to see that are IPTA members, that they can influence the future generations because they don't even realize that this program exists because it's just a link on a website. So unfortunately, there's bureaucracy, there's red tape, and there's tradition, and then there's reality, right? And tradition is we do email marketing. Tradition is we go and step up at meetings and talk about what we want to say. Reality is there's 2 billion people on Facebook. Reality is 8 out of 10 households are on Facebook. Reality is social media is the new internet. We spend more time jumping onto social media platforms, whether it be Snapchat, Instagram, Facebook, TikTok, what have you, instead of actually going to Google searching. And so if that's the case, why are we not attacking this? And I kind of know why. It's because it's harder to control. When you're in a larger organization, there has to be some oversight. And if you feel you have to control everything, then to me, it says that you don't trust the people that you're delegating to. And that's part of the reason why I say at the moment I'm the chair, because I don't know if I would step back into this position again because I can't fly. I can't do what I want to do because of the oversight that needs to take place. And I understand, but I'd love to come back to you with reports about how many people we've gained, how many members have joined because they want this value. I'd love to come back to you with that, but unfortunately, I can't fly, so I can't get those numbers.
Sure. And I think it also does depend because I think that, Like I can speak for my state chapter. I mean, they are very open for a lot of things, like willing to listen, willing to, experiment and different things. And I've heard some good things from other chapters, and I have heard maybe some similar stories to what you had said about others. So I think there's definitely still some variability throughout the country.
Yeah, again, I think it's old guard, new guard, right? It's social media is still something to be afraid of versus social media is something for us to utilize. Figure out how can we build our brand of the Illinois Physical Therapy Association on a Facebook platform, on an Instagram platform, on a Snapchat platform, instead of having to do it one-on-one. I'll give you an example. A long time ago, I was the vice chair of the East Central District, and we would consistently have our meetings in one location because that's where a majority of the board for that district worked. But our district spans a very large area, and we can't be everywhere. But yet we have platforms such as Zoom, where you can, come in. You can have a Facebook group and do a Facebook Live to reach all of your members that are within that area. But if we're not using technology, then we're staying where we're at while other people are advancing forward. And again, I was the vice chair back in, I'm going to guess 2010. It's still not being utilized. We're still depending on only the people that show up in person, face to face. We're missing a huge demographic of our own members because we're not willing to implement technology.
Yeah, and Vince, I kind of want to add one last little part to this kind of topic here, because something that I've kind of heard from others, a part of what you've mentioned is kind of when it comes to our national organization and even the sections or chapters, shall we say, is sometimes it's hard to kind of get a feeling of inclusivity into that group. What do you think about that?
I understand. I mean, even at our local district level, some people feel like outsiders because it's the same people stepping up over and over and over again. But I understand it from their point of view. They're the only ones stepping up. It's hard for them to cater to everybody else if nobody else is going to step up and take charge. But for those that are trying to come in, they only see it dominated by a certain group of people, and they may feel a little intimidated and not want to come back. And so I understand how hard it is to become part of the group, but we are physical therapists. Our career is built off of communication with patients. We should be able to communicate openly and freely with other professionals. And we mentioned it a little bit earlier before we actually went live. At the next conference, I mean, there were 5 or 6 of us from across the country that came together just to network. We didn't necessarily go to the conference. We didn't pay tickets to go to the conference. We drove 2 hours. They flew across the country. Somebody drove almost 3 hours to get there to have a conversation. And I think that's the type of inclusivity that we want in our profession, where people are willing to come and drive and take time out of their day and spend money on gas to come and have conversations. And that's how open we need to be.
Yeah, and Vince, I'm going to throw one last caveat in here because you kind of prompted a question. So a while back, this is a few months ago, recently after the Graham sessions, and I'll admit I have never been to the Graham sessions. I've heard great things about it, so I'm not knocking anything about the Graham sessions. I'm sure it's great, and I understand why it's there.
Right.
But I had done a post.
I think I know where this is going.
Yeah, but I had done a post that very politely kind of just said, I think it's kind of unfortunate that we have to have an event like this to be able to have that kind of dialogue.
We're just people. None of us have the answers, but when we come together, we can at least see other perspectives, but we don't come together enough. I mean, we come together on social media in these groups, but this is where I can honestly say I'm proud of the BPT Mentor page. It's not my page. Okay. Some people misunderstand that and they believe that it's my page. It's not mine. I'm very active on it. And one of the things that I am proud of this group is that this group has been going strong now for 2 years. And in 2 years, there has been one negative comment. There has only been one person who was negative. And that person, and I jumped in immediately and politely asked that person to stop. And then I jumped in again and not so politely asked that person to stop. So I am extremely proud of that because we need to have open dialogue, but there needs to be safe havens for this open dialogue. I was asked to speak at an IPTA event called Resumes and Residencies. And so I spoke on the resume portion, on how to build your brand and how to push the profession forward and how to get your first job and what your first term looks like. But I stuck around for the residency portion. And obviously everybody up there was resident. Either they finished, they instruct in that program, or they're in the program. I politely asked the question if anybody had read the research about the residency programs in orthopedics and is there value in it in terms of outcomes. But only a couple people had read the research. And I know Paul cites this frequently for fellowships, but there's a portion in there for residencies where having gone through a residency does not give you any better outcomes. And I think that's the stuff that we need to make sure the students understand, because you could spend 9 months of your career going through this program and not come out with better outcomes than somebody who's been practicing for 5 or 6 years. Is it worth it?
Well, if I may, Vince, I'm gonna challenge you a little bit, because reading that article, I completely agree. I mean, that's definitely a thing. I mean, there certainly were definite limitations with that study that we cannot generalize given the nature of it. But I thought it was interesting looking at kind of the outline of the subjects that they had selected to compare. So, yeah, I mean, is it true that there wasn't a big difference between people who hadn't gone through and people that had? True, but I also think we have to also look at some of the demographics of the people that didn't go through, because we're looking at
10 years out.
Right. So it's like, is it okay? Yeah, it's no different, but these people that went through residency did it much quicker and got to a certain level faster, Then
I think those studies need to be reproduced with not just 10 years, but 5 years. The question becomes, how much of your time is worth giving up in order to become good? And how much of your income is worth giving up in order to become good? And if you believe that it's worth it, awesome, go through it. I'm not saying don't go through it. I'm just saying reflect on it, and whether or not you believe giving up half of your income for a year is worth it when you're going to get there if you just independently study over the course of 5 to 10 years.
Yeah, no, I think that's a completely fair question. And there's not a lot of research on residency fellowship. I mean, there's more that's starting to come out, but there's still a lot we don't know about. So I think we're going to continue to research and kind of figure that more out as time comes. But right now, we just don't definitively know.
But we're pushing it on students. That's the part that I struggle with. Know whether or not it's good, but we know we want you to do it. I struggle.
Yeah, and I know that is certainly a end point or a long-term goal to make residency the normal continuum after entry-level education. And of course, that's going to take years and years and years for that to happen if that does go as intended. But you're absolutely correct that is certainly in a long-term vision.
Yeah, prove it's worth, and then I'm on board, 100%.
Well, there we go. Challenge accepted. Well, Vince, I know, of course, you answered our finale question a little bit earlier, but I'm gonna make you switch here a little bit because I want to get another answer, your number 2 answer. So, apart from wanting to change, of course, teaching more ethics and being able to kind of facilitate students as people that can go in and enforce change, if you could change another aspect of healthcare education, whether that be physical therapy or otherwise, which aspect would you change, and how would you change it?
I think we need to integrate more with other healthcare professionals. I worked in a private practice, and in private practice, boo-hoo hospital systems, boo-hoo physician-owned practices. And so my next job, one of my big jobs, was at a hospital practice. And I got to, have conversations with emergency room doctors, physiatrists. We created a spine care program there with the physiatrists. I think it's really interesting to understand how I got that job. When I applied for that job with the director said, "I'm sorry, we don't have any outpatient ortho jobs available." And I said, "I'm sorry, I don't do acute care. So I guess we're at an impasse and I'm going to walk away." And he said, "Well, wait, just tell me what you do." I said, I solve puzzles. I enjoy working with patients and trying to figure out the root cause of their symptoms and trying to see if we can make a change for the positive. And so the director said, "Fine, you can interview with the 3 physiatrists that are our medical directors, and if they want to hire you, we will take you on." And the medical director, Dr. Mochizuki, gotta love that guy, he said, "Vince, I'm only going to ask you one question. If we give you the diagnosis of spinal stenosis, what are you going to do?" And as a student, the easy answer is, well, I'm going to do a flexion-based program with this patient and try to reduce symptoms. But really what I said is, I'm going to put this patient through an assessment to correlate what you found on imaging to determine whether or not this is neurogenic claudication, vascular claudication, or it's not stenosis clinically. And he said, well, do you have any evidence on that? And I said, yeah, there's some theoretical models out there. And I cited the source, it's just what I do. I cited the source, and, we pulled up the journal article, and he goes, wow, I'd never seen this before. But it was an algorithm to try to figure out whether or not you were looking at spinal stenosis clinically. And he said, Vince, we don't have anybody on our team that thinks like that. You're hired. As students, if we can get them comfortable with talking to physicians as colleagues and not as technicians to the physician, I think our profession will do a better job of moving forward. Because of the confidence that I developed to, talking with physicians, I now work in physicians in practice, and I get called in as a consultation for any orthopedic issue. That was because of the integration into the healthcare system. Instead of seeing our profession as an island, I am out there working side by side with nurse practitioners, physicians, podiatrists. It's what we have to do in our profession. We have to push forward. And I think that starts in school.
Yeah, I think that's a very good answer, Vince. And ironically, that's one of our top answers that we get. We, of course, our number one most common answer to that question is obviously finances. Number two is usually something that involves either a curriculum change or clinical education. And then third is kind of what you had just said, more interprofessional involvement or interdisciplinary, education opportunities. So that certainly seems to be a very prevalent answer that we get.
Oh, that's good. I don't feel like an outlier then.
now you're like, I got to think of something else, right? I got to find something else to make me an outlier, right? Well, Vince, I appreciate everything, your insight and everything, your passion, and just your authenticity is just so palpable and so strong. And I'm so grateful that we have you in this profession and for all that you do. And I understand that so many other people might either want to learn more about what you do, or maybe even just want to touch base and just maybe a follow up on a question. Where can people find you should they want to either just reach out or just start a dialogue?
It's funny. I have so many conversations every day of the week during my commute. I tell everybody, 815-210-4869. Give me a call. I'm very accessible.
There you go. Now, do people have to leave a voicemail to either to get you, or are you pretty good at picking up random numbers?
If I'm with a patient, I don't answer. If I'm with my kids, I don't answer. If I'm in the car, I will always answer and put you on speaker.
Well, there you have it. You can also, I know, Vince, you have your website, and of course, you're active on the DPT Mentors page.
Yeah. You can movementthinker.org. I have a YouTube page, Dr. Vince Gutierrez, PT, DPT Mentors. There's a lot of places to find me, but one-on-one conversations, that's what I thrive on.
Absolutely. And you're still doing the podcast, right?
I do the podcast. Yeah, I'm in the process of putting together a video series to educate patients on what to expect from PT when you go with low back pain, and then I'm going to pull that audio into the podcast.
That's perfect. I love it, man. Well, thank you so much for coming on. Thanks for all that you do. It's been a pleasure having you on, man.
Thank you. I appreciate this.
Access to healthcare is one of the largest issues facing both providers and patients, as millions of people worldwide lack timely and affordable access to healthcare. Anywhere Healthcare, a telehealth platform, is a simple, low-cost option for providers and patients that eliminates the barriers to access to all kinds of healthcare. To find out more, check out anywhere.healthcare, which is available on our show notes. And if you use the code HET in all caps when you email to sign up, you'll save 25% off the total cost. Thank you for attending class today, and we hope that you learned something and gained value from the content.
If you'd like to schedule office hours with us, feel free to add us on Twitter at HET Podcast, on Instagram, HET Podcast, on Facebook, the Healthcare Education Transformation Podcast, and the homepage, healthcareeducationtransformationpodcast.com.
And for those of you following along in the syllabus, extra credit can be obtained by liking us, sharing us, and leaving a review.
Let's continue our journey up Mount Educational Success as lifelong learners.